You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, she says that nobody should be wearing a loose-fitting denture. We're talking about dental implants today. With us, we have an expert on this topic, Dr. Christine Lathuras. Dr. Lathuras, welcome to the program.
Thanks, Randy. Thanks for having me.
Now, and I know you brought some photos, so we'll try to get to as many of those as possible.
Okay.
But for people that don't know your practice, like who's the typical patient that comes in for dental implants?
Well, typically there's two different types of people who come in. The first one is people who have had dentures for a long time and they really hate them. Okay. They can't eat, they move around, there's too much in their mouths. The second type is the type of patient who's been going to the dentist for a long time or maybe not going to the dentist and their teeth are hurting and they've spent a lot of money and now they just want some sort of solution so that they can feel happy and feel comfortable and smile and eat what they want.
Okay, now your practice. I mean, you have a fairly large practice. Mm-hmm. And we should mention, I guess, how dental implant dentistry is done normally, typically, is you go to one place that does the surgery and then another dentist that puts the teeth on top and maybe somewhere else for the imaging.
Yes.
You do it all right there.
We sure do.
So aside from convenience, what's the benefit of the patient?
Well, the benefit to the patient is they only have to come once to have the whole procedure done. Okay, so we do a 3D image in the beginning, and then the next appointment, we're doing the surgery, and they're leaving with their new smile.
Is that right? You say it's like they could come in with old teeth that you can't save, and they walk out with a brand new set of teeth.
Absolutely.
Is that real?
Yeah, it's real.
Is that typical?
Every day.
Is that right?
Mm-hmm.
Now, at the top of the show, we said no more dentures, no more traditional dentures.
Sure.
You believe that?
Oh, gosh, absolutely. I can't even believe that we still have dentures.
Is that right?
Yeah, in the world of dentistry, why are we even still doing that in this day and age?
Do you think this is the future of dentistry, that maybe 10 years or 20 years or 100 years, that dentures as we know them today won't exist? They'll all be attached to something? They'll all be attached to implants or something?
Well, Randy, the future is now.
Okay.
I mean, that's what we're doing every day.
Now, where you are, because we talk about denture wearers, are there a lot of people wearing dentures in Connecticut?
Oh gosh, yes. There's tens of thousands of people who are wearing dentures, either one or two, or they've had them for years and years and years. They don't fit. They're moving all around. They're miserable.
Well, if implants are so good, then why aren't they all doing it? What's your take on it? Why aren't they all coming in to do it?
Yeah, well, the problem is with dentures is people who have dentures, they don't think they have to go back to the dentist anymore. So they don't even know what's available out there, which is the main reason why I decided to come here today, so that we can let them know that there's something else available for them. Another reason they don't come, Randy, is because before they got their dentures, they typically had bad teeth. They maybe had a root canal that failed, they had broken teeth that got tried to be fixed by crowns, and they were patched here and there. They went from dentist to dentist to dentist, each one trying, and then eventually they lost their teeth. Now they're dealing with their dentures that don't fit. They're miserable. They can't eat what they want. They're always worried about when they sneeze, they might come flying out of their mouths.
Do you hear that?
Absolutely, every day.
Is that right?
Yes, and it's miserable.
So these denture wearers, the last thing they want to do is see you. Well, after all they've went through to lose their teeth. Do you hear that? Like, no offense, doctor?
Every day.
Really?
They come in and they say, I hate coming to the dentist. Actually, I have to say, there's a lot of people who will come in and they'll say, it took me everything I had to get here today. And I tell them how proud I am of them for coming.
Yeah, I mean, nobody likes going to the dentist.
No.
Do you have a funny comeback after all these years of them saying this to you?
Well, not really. I just tell them I'm proud of them.
What about people that have really bad gums? Mm-hmm. The bleeding gums, the periodontal disease. Are their gums too bad to get new teeth with dental implants?
Oh, no, of course not. So that is the number one reason why adults lose their teeth is from periodontal disease. And they kind of know as they're getting older that they're getting it because they maybe have bad breath or their gums are bleeding. And unfortunately, when it gets to the point and they have to lose their teeth, as soon as we take the teeth out, the disease is gone.
Okay.
So the implants go in and they're immediately healthy.
So without the teeth, what, the infection goes away?
Yeah.
Okay.
So they're immediately healthy. So what other medical field can you go into and go in and a couple hours later you come out and you're completely healthy?
Is that right?
Mm-hmm.
And so that's not a reason not to do it then. What about age? How old can you be to get this done?
Any age. Any age. I think my oldest client who had the upper and lower fixed dentures was 92 years old.
Why would a 92-year-old want to do this?
A lot of reasons grandparents want to do this, Randy, is because their grandchildren look at their teeth and wonder why they don't smile or why they can't eat what they want or why their teeth look so funny. That's the main reason I get.
Is that right?
Yes. But another reason I get is because they want to enjoy life. I mean, face it, Americans revolve their lives around food and eating. Those are all our dates, our holidays, everything revolves around food.
So 92 years old, they're not statistically more likely to fall out?
Sure.
So age doesn't really...
Has nothing to do with it.
What if you have a little bit of osteoporosis?
Not a problem.
Is that right? Now, and most of these people are doing oral sedation to get this done?
Oral sedation, yeah. Yeah. It's very simple, very simple. And they're comfortable throughout the whole procedure, and the procedure doesn't even take that long. It's a couple of hours.
Okay, good. Now, this is like because I guess it's not a recognized specialty, implant dentistry, but this is the focus. This is all you do. Tell me a little bit about your practice, because you have a couple of other dentists that work there.
So I have a large group practice, and you can come into my practice and get anything done that you want. My specific focus is the dental implants and the fixed bridges. That's what I do.
You told me in the green room, that's all I want to do.
That is all I do.
Why? Why do you like it so much? Because you did. You said, I love it.
I love it. I love it because it changes people's lives. When someone comes in my office and they're covering their mouth and they feel badly about themselves, and then they can leave my office with a big smile on their face, what better is that?
Now, you brought some photos.
I brought some photos.
So what are we looking at?
All right, Randy. This is a nice young lady. She's 35 years old. She came into my office a few months ago with her mom, and she's been not feeling good about herself. Her teeth are just literally rotting out of her mouth.
That's got to be unusual to see that.
I see it every day.
Really?
Yeah, and the thing is with these patients, they come in so embarrassed because they think they're the only ones who look like this. But we see it every day. So in their life, they might be the only one. But we try and make them relax right away.
So we never see these people because what? They just don't smile.
They're always covering their mouths.
They never smile.
Of course.
So that's really common.
Very common.
Okay, so I interrupted you. So back to this patient. So she comes in. What are her options? And what are her main complaints?
Her main complaints are she can't smile, and she feels terrible about herself.
Okay.
So as far as I'm concerned, her one option, which is what's best for her, is implant bridges. Look at what it's done to her appearance.
It's very nice, yeah.
Look at her eyes. Even her eyes are smiling and they're shining. She looks happy now.
She looks like a different kind of a person.
She is absolutely a different kind of a person.
Yeah, we talked on the phone and we were saying, when it's all done, they may, look a little more sophisticated, more refined, more educated. And when I hear things like that from a dentist, I'm thinking, well, it's just teeth. But I think this demonstrates that it makes a big deal.
It makes a huge deal. And, to say just teeth, I mean, what's the first thing you look at when you see someone?
Yeah, yeah.
Especially if they're smiling. And if they're not smiling, something's missing.
Now, in the after, you say that sometimes you'll see physical changes, like they start eating better or dressing differently.
Yes. Yes, and that happens all the time. They get their hair done. You can see here she's not wearing her glasses anymore. They go out and get a new job, things like that. And a lot of people, what they might hear is they're not a candidate for dental implants because they might have some medical conditions. But the problem with that is in order to have good medical conditions, you have to be able to eat a good diet. And if you have dentures that are moving all over the place, you can't eat a good diet.
Yeah.
So how can you take care of yourself? So that should not be something that keeps people away.
So now, but isn't it true if you've been wearing dentures like, let's say 10 or 15 or 20 years, you can't do this, you don't have enough bone?
Oh, no, that's not true at all. There are so many ways today to rebuild bone, and it changes all the time. It's amazing. I know in the past it was very barbaric how they would do bone grafts. Today, it's a piece of cake. I had a patient who was told he didn't have enough bone. He had gone to another dentist, and then he came in to see me, and he said, but I don't have enough bone. And I said, well, of course you do. So we gave him some new teeth on implants, and the funny thing about him is he's in the food industry. He's a top exec in the food industry. And he would always say to me, Dr. Lathuras, I take people out to the best steakhouses in New York, and I have to eat salmon because I can't eat the steak. He was in last week, took out his phone, showed me the photo of himself eating steak.
Is that right? So they want to show you a photo of them?
Absolutely.
So do you hear a lot of eating stories?
Oh, yeah.
And now, what can they eat? And
typically they can eat whatever they want.
Okay.
What's really funny is I hear people want to eat sandwiches. They want to bite into a sandwich.
Oh.
You know, the good hard Italian bread.
Because with the denture, what, they can't like tug or...
No, can't. You can't eat
Or
a lot of
pizza
things
or
with
whatever.
dentures. You really can't. You know, people put up with it and learn to live with it, but you really can't. And if people were if you really were going to ask people, they would tell you.
Now we should mention, I guess, even with the best dental insurance, this is not covered. The dental implants are covered. Cover a small portion. Medicare, Medicaid covers a small portion as well. So what's the answer?
But we can do financing. And there's several companies that do financing, and we have people at our office who do only that. So they're experts in getting people the financing that they need.
So you're not carrying it. So you have to have like decent credit.
You have to have decent credit to get it, of course. And then there'll be a monthly payment, of course, with any financing.
So they're doing it every day. This
Every
is like
day.
a big thing.
Every day.
Is that right? Now, when it's all done, is this one of those kind of procedures when you take somebody with no teeth and now you give them teeth that don't come in and out? Do they say, I should have done this years ago?
They absolutely do. But they're really happy when they do it. You know, and you know, most of these people have been shopping around for the right thing for many years.
Is that right?
Oh yeah. They go to dentist to dentist to dentist. And then the greatest part is when they come in and they see that this is available, and then it's easy for them to make their decision. So I had this one patient, and you know, we were sitting down discussing. It was her first consultation appointment, and she was telling me how she went online and she's doing research, and she's, you know, that can be a little daunting when you go online and look for research, because you can find things that are going to say anything about everything. She had been to 5 different dentists before over the course of 5 to 6 years. And then finally she came in. And you know, when people do that, a lot of people tell me that story, that they've been looking for a long time. And the question I always say to them, well, what had you come in today?
Yeah.
That's always the question.
And what do they say?
I ask. Well, you know, it's different for some people, but most people say, I'm just sick and tired of it and I want to live my life.
But why did they go to 5 other places and not do it and finally do it with you? Obviously they like you, but
well, you know,
do they say?
Yeah, sometimes they say that someone recommended dentures and they knew they didn't want dentures. Someone recommend trying to save the money and patch up what they had. Lots of dentists will say, well, just keep what you have for as long as you can. And we all know that with periodontal disease, to keep your teeth...
So that's a bit insensitive in your mind, for a dentist to say, just keep what you have for as long as you can.
If the patient's telling you they want something different, you want to offer them something different.
More than half of dentists don't do dental implants.
No.
Is that right?
Oh, absolutely.
So do you think there's a lot of people that just aren't even offered this option to get a new set of teeth with implants?
Of course. And not only don't a lot of dentists do dental implants, but this is a specific procedure we're talking about where you walk out with a new set of teeth in one day.
Is that right? So on the day of the procedure, they could go in with no teeth and walk out with teeth. Like a brand new set of teeth, as you put it.
Yes. Or they walk in with a mouthful of teeth that aren't any
bad.
good for them, and we take them out and restructure their bone, and they walk out with their new smile.
The teeth, they look real? I mean, I've seen
yeah.
some of this.
Yes.
But I always feel like I could spot a denture, like walking down the street.
Well, these aren't dentures.
Okay.
Okay, so I want you to...
So, well, I'm not going to call them dentures anymore. It's like they're teeth again.
They are. They're the most natural thing that you can get to replace your teeth.
How soon can you eat after the procedure?
As soon as the anesthesia wears off, a couple of hours.
Is that right?
Absolutely. And they come back and they tell me.
It seems very painful to do this.
For me or for the patient?
So no pain for you, right? Okay.
Honestly, though, what they tell me is they come back. The first night is a little uncomfortable. They usually just take Advil or Tylenol, and that controls it. And by the next day, they're feeling pretty good.
They're fine. So a little bit of a soft diet at the beginning, but before you know it, what? You could eat like an apple with your front teeth, or you have to be careful with the front teeth?
No, you can eat an apple. I would say probably most patients within a week.
So would you say, so the implant crowd, the people that you give their teeth, the happiest group of patients?
They're the happiest group because they now have a life that they can live, you know? And it makes me the happiest because I can contribute to that. And what's better than that?
Now, you're a dentist, so it does not surprise me to think that you probably think that the smile's like the most important thing.
Well, it is the
How
most
important
important.
is a smile in your
It's so
view?
important.
Okay.
When someone's walking down the street and they're coming towards you, if they're not smiling, you're probably going to look away or look down or be a little nervous. But if someone's smiling, you smile back and you say hello. It makes all the difference in the world. And you know, when people are on dating sites, that's always one of the top 3 things they say. Think about a job interview.
All right.
If you have 2 potential employees coming in, one's smiling, one's feeling good about themselves, one is showing you their inner heart, the other person's not smiling at all, You're wondering what's going on with that person. Why are they so unhappy? Who do you want to hire out of those two people?
That's a good point. The one that looks happy,
Who do you want your clients to face every day when they come in?
We talked off camera about that people with bad teeth are judged.
Yes.
Elaborate on that.
If you go to Hollywood and you look at certain movies, right? If they want someone to look poor, they're going to give them really bad teeth. If they want someone to look really wealthy and successful, they're going to make their teeth look the best that they can look. So that's in our society. We do judge people by their looks. And since your smile is one of the first things you portray, it is. Unfortunately, we are judged in that way.
And you say they change. Like you take somebody with really bad teeth, you give them good teeth, and they come in for their follow-ups or whatever. They're like different people.
Of course.
What does that mean? Tell me about that. What do you mean?
They're feeling better about themselves.
And you could see it or feel it?
You can see it. Before maybe they would cover their mouth and, sort of hunch their shoulders a little bit and not feel so good about themselves. Now they're just out there and they're smiling and they got their hair cut and they come in and they say hello and they're a whole new person, really. And everyone notices it.
Is that right? So even your team at the office, your staff?
Oh. Yes.
They're not even the same people?
No.
On a consult, let's say you're on a consult. Somebody, you can't save their teeth, right? Dentures or new teeth, brand new teeth, as you call it, supported by dental implants. Do you ever get kind of excited because you think this is going to be good? Like they have no idea how good this is going to be.
Oh yeah, I'm always excited. Those are my favorite appointments. When I walk into my office in the day and I look at my schedule, the consult is my favorite appointment because I know I'm going to have the opportunity to change someone's life.
So what do they like the most? The new smile as far as the way it looks, or do they like the fact that they could eat and chew?
Well, initially, when they look in the mirror and cry, they're interested about how great the smile looks. But after time goes by, and they realize they can eat again, and they realize they can go out to dinner and socialize, and they realize that people are, enjoying their company, that's what really makes the difference for them. Okay,
now we're gonna take a quick break, and we come back, more of your photos and more about the implant process of what they could expect on day one. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
Hi, my name is Bianca McDonald, and I've been coming to Sunrise Dental Care for the past 3 or 4 years, and they did a lot of great works on my teeth. And I had implants done. It was so easy, everything works out perfectly, and I wasn't afraid at all. And my 2 front teeth, that's where we had it done. And Dr. Lathuras did the wonderful work on me. So I wouldn't, I would go do it again if I have to. It's very easy and it's, there's no pain. They did a great job and there's nothing more I can say, but I would recommend for anyone to come here and have their works done, their teeth work done. So that's all I can say, and today I came in for my checkup and everything looks wonderful.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to Dr. Lathuras, nobody should be wearing a loose-fitting denture. Dr. Lathuras, welcome back to the program.
Thanks, Randy.
Now, you brought more photos.
Yes. Let me share some with you. This is a nice patient of mine. She came in. This is actually a really funny story because she came in and, like everybody else who comes in like this, she kind of had her mouth covered and she was, like this. We went to the same high school together many years ago.
All right.
And we sort of developed that out of just talking in the consult.
That's a good story.
And what I love about doing my consults is that people come in feeling awful about their teeth. I don't talk to them about their teeth. We are not our teeth.
Okay.
We are our person. And then we decide what's best for them. And that's what we did with her. And in that, we figured out we went to the same high school together a long time ago.
Okay.
And so now, she comes in all the time and she's just joyous all the time. She travels around the country with her son.
Looks very nice.
She looks awesome. She got a haircut, she got a new job, and she travels around with her son, who is a fencer.
Okay.
And now she has a great time everywhere she goes because she can go out to eat and do whatever she wants.
Can you do, if everything works out right, in one day you can do the extractions and give them new teeth the same day.
That is what we do.
Is that what you did for her?
Absolutely.
Is that right?
Yep.
So when it's all done, because you're former classmates in high school, or you went to the same high school,
Yeah.
what does she say?
She says the procedure was fine. It wasn't hurtful at all. Within a week, she was eating anything she wanted. And the biggest thing for her now really is that she feels good about herself.
Now, you say some people are compelled to get out of the chair and hug you when it's all done.
Yeah.
That happens?
Not only does that happen after the procedure, but that happens when they know that I'm going to be able to help them. Because most of these people have been very unhappy about their smile for a long time. And just when they make the decision and they know what can be and what they're going to do now, they hug me then.
And we've talked a little bit about this, but there's a lot of people with money, plenty of money to do this, but is it their fear of the dentist? They just don't want to do it. Like you see them with really bad teeth. I was watching a CEO on television, I don't know if I told you this, rotted out bottom teeth.
Yeah.
Is it their fear, or they don't realize how bad it is to look at these bad teeth?
You know, a lot of times people have just been living with themselves for a long time and they've started to accept the way it is.
So they don't even see it as a real issue.
They don't even see it. And they might not know what's possible. And you know, really, who's going to go up to somebody out in the street and say, even if you're friends,
That's a good point,
you know,
yes.
why don't you do something about that? Let me show you this next patient. This was a patient who actually was a patient of mine for a long time. And she did know what was possible because I had been telling her. And she just wasn't ready. And her infections kept growing and growing. And I said, you really need to do something now.
So you couldn't save those teeth?
There was no way.
Okay.
There was no way. She was just coming in for her cleanings. And so one day she said, you know what? I'm retiring and I'm going to do my teeth. So with her, what we did is we took out the rest of her teeth and we put in a few implants and she got her new teeth. And look at that smile. Isn't that unbelievable?
It's like an authentic smile.
Yeah,
that's very nice.
That's the smile. That's the smile that we show all the consults who come in.
So like when you say a few implants, like 4 or 5 implants, and you get a full arch of teeth
Yes.
that are attached, fixed to those.
A lot of people think it's 1 implant per tooth, but it's actually not.
And like this woman right here, how soon can she eat?
She ate when she went home. She came back 5 days later for a post-op, and I said, you know, have you been eating? Are you still eating soft? She said, I ate chicken that night.
Is that right?
Yeah.
So you could do it right away.
Right away.
And they probably, they obviously smile more with those
Oh gosh,
teeth.
they don't stop smiling.
So when it's all done, how do they maintain them? Like what's the protocol? Is it just like getting your teeth, regular teeth?
Yeah, it's just like regular teeth. So at home, they brush them just like they normally would, and we get to see them every 6 months like anybody else who has their teeth. And they like coming to see us now.
Is that right? So when they come in like on the 6 months, they always want to tell you that this is... Now, is this one of those things where partners come in together?
Yes.
Husband and wife, whatever.
Yes,
like one gets it done, and then another one gets it done.
Friends, yes. I mean, once they're like this, whether they're talking about it or not, everyone's noticing.
Is that, what do you mean by that?
Everyone around them notices because they're smiling now.
Okay.
You know, and they say, what'd you do? You know, sometimes they don't know it's their teeth. Sometimes they'll say, did you get new glasses? Did you get your hair done? But it's their smile.
Okay, good. Now, we are short on time, and I know you wanted to show, I guess you have a couple more photos left. Let's take a look.
So Randy, take a look at this one. This was not a full mouth set of implants. This patient only needed a couple of single implants. But look at the change in her smile. When this patient first came in, she's a police officer, and she would come in, she never smiled, never. And I was really scared of her. Every time I saw her on the schedule, I was a little intimidated because she never smiled.
So she doesn't look like she's happy.
I always thought she was mad about something.
Okay.
And when we finished her smile, I mean, look at that. She's a changed person. Now she comes in, hugs me all the time. Never stops smiling.
I mean, it's a very authentic, very, very nice smile.
Yeah.
And she would have, so this is a person, you do what, a combination of procedures? Like,
yes. She had some teeth straightening, she had a couple of implants, and she had some crowns and veneers. Yeah. And she's thrilled. And she is one of the patients who said, I wish I had done this a long time ago. So if I have time for one more, Randy, I really want to show you this one. This is one of my best friends, okay? And I hadn't talked to her about her teeth for a long time because I knew that she was self-conscious about them. So I was waiting for her to bring it up to me. But she was always covering her mouth. And, you know, being in front of me as a dentist, she was even more self-conscious.
Yeah.
And, you know, look at all the spaces in the before picture. We would go out to eat and she would do this and pick out all the food from her teeth. So one day I said to her, I said, let me fix your teeth. And she said, well, how can you? I've been asking dentists my whole life to fix my teeth for me, and they said they couldn't do it. I said, I can fix your teeth. Why don't you just let me do it? Look at her. She's gorgeous.
Very nice.
Gorgeous, right? And this is just all crowns. No implants, just all crowns. But the change that a smile can make to her face, it's astonishing.
So it's more than just teeth.
Oh, gosh, yeah. I mean, your smile shows what's inside of you, right?
Yeah.
Imagine what it's like to be living a life of, you know, you have a heart full of love, but you can't show it because you can't smile.
Now we're short on time, so I'll kind of rush you a little bit here. If a denture wearer comes in, or the other group, the people that you cannot save their teeth,
Okay.
what are their options when it comes to dental implants?
Well, if they already have a denture, they can get dental implants put in and use that same denture. But
Okay.
now it's not going to move around as much. But it's still a denture, so it's going to move somewhat, and they're still going to have a lot of plastic in their mouth. Or they can add a few more implants, and then
Like how many?
Just a couple more.
Okay.
Okay.
Like 4 implants.
4, 5, you know.
All right.
And they can have these teeth that don't come out. And they feel much more natural. They don't have all that plastic pushing their lip out and everything else. So with the denture and all that plastic, their tongue is always in the way. They can't talk the way they used to talk. And then on the top, it covers your palate. So again, your speaking isn't good. You can't taste anything. They're miserable. You can go and you can get the implants and the fixed teeth, and then you have a regular smile again.
Now, final message. Somebody watching this, their teeth have to go. Maybe they were told elsewhere your only option is a denture or the actual denture wear. And they've heard what you had to say, but for whatever reason, they're still afraid or skeptical or whatever. What do you say to them?
Well, you know what? Everyone's afraid and everyone's skeptical, and we all have issues with time and schedule and costs and everything else. Just come in and talk to me. We'll have a conversation and we'll do what's best for you.
It's a free consultation to come in?
Absolutely. And we do a 3D exam.
Okay. Which means they get imaging.
Yes, and it's free imaging.
Okay.
Okay, and this is just like an MRI. And it's not available in a lot of offices, but we have had it for several years now.
So you include it.
It's all included.
So I want to thank you for coming on the show. Great information.
Great. Thanks, Ernie.
Appreciate
Thanks
it.
for having me.
And all of this information can be found on your website. Do they make an appointment through the website?
They
How do
can
you
call
do
the
that?
office. They can do it on the website. We also have a Facebook. We're on Instagram.
Thanks again. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.